Firstly, good morning and a warm welcome from the Global Healthcare Management Program at the GBSH UCL. I'm Dr. Shaila Zaidi. I'm the program lead for Global Healthcare Management across all three routes of leadership, finance, and analytics. And with me is Dr. Yemisi Bolade-Ogunfodun, who is the route lead for the Global Healthcare Management Leadership route. And we are both absolutely delighted to have you with us today for the taster session. Just a couple of quick things before we start. The session is being recorded and a link will be sent to you via email probably next week. So don't worry if you miss anything, you will get a link to the full recorded session. You can type in questions in the chat box, and after the lecture, we will circle back and come back to address your questions. So we will have 10 minutes for the questions later. So let me start by introducing Yemisi. So Yemisi is the Associate Professor in Organizational Behavior at GBSH UCL. She is the route lead for Global Healthcare Management. And importantly, she leads the Leadership and Management module, which is one of the first modules that our students take in term 1. And then she goes on to co-lead another very important module, which is on organizational behavior and human workforce. So in addition, she convenes the leadership modules across the route. Yemisi has applied a multidisciplinary perspective to all her teaching and research with a focus on leadership, entrepreneurship, human resource management, sociology, and organizational behavior. I'm now going to hand it over to Yemisi and we will start the taster lecture. Thank you so much for being here today.
Thank you very much, Shaila. And hello to everyone who is on the call with us today. I'm really, really delighted that you're here. Thank you for coming. It's a pleasure to give you a taste of what you can expect at UCL Global Business School for Health. So I'm going to share my slides with you. I have some slides I prepared. Hopefully everyone will be able to see. So please let me know if you're able to see. Okay, there we are. You could just type a yes in the chat if you're able to see that, and I will make that bigger. Okay, so I've given the topic of the lecture today a title. It's really centered around leadership, but I've called it Understanding Leadership as an Imperative for Resilience in Global Healthcare Management Systems. Understanding leadership as an imperative, something that you need to absolutely have in order to have resilient healthcare systems. Now, if you haven't seen this before, this is a little sneak peek of UCL, the main campus. Wonderful building, historic buildings, well maintained. You will enjoy that when you come to us. But I'm not going to stay on this slide. I'm going to move on. And I'll give you a little bit of an outline of what we're going to do. So Shaila has done some introduction. You know who I am, but I would like to know who is on the call today. So I'll ask you a few questions and I'd like you to give me the answers. And then I'll go on to the topic itself. And when I'm done, we'll have opportunity to take questions from you and we will do our best to answer as well. Okay, so I wouldn't go over myself because you already know this, but I want you to scan the QR code or go to menti.com and type in this code in there. Can you see that? So if you bring your phone out and scan the QR code, it should take you to some questions. And the very first one is to tell us where you are joining us from. So I'm going to show the results live so that we can all have a sense of who is in the class. So this is what you get at the Global Business School for Health. You know who is in the class with you. So we're going to do that. And I'm going to show you once the answers are coming through. India, hello. Someone is from the UK right next to us. Okay. Who else is in the house? From China. Thank you. I wonder what time it is in China now. It must be close to evening or night. Another person from London. Okay, a couple of people from London. Indonesia. Fantastic. Fantastic. Indeed, this mirrors what we have in the business school. It's a really, really diverse cohort that we often have. Another person from India. Okay, waiting for the rest. There's still a few people who haven't responded yet. Where are you from? London, United States. Oh, someone is from the US. Thank you for joining from the US. That's really early in the US. Thank you. Thank you for that. Fantastic. Okay, so people are still typing in. Maybe a couple more people typing in. You can, clearly see this is from east to west. And that's important when you are in the classroom, particularly in the smaller group sessions when we have seminars, because you are able to bring in diverse perspectives to the issues we discuss. Different perspectives. This is what it means where I'm from. This is what it means in this part of the world. These are the challenges we're likely to have. So that's the significance of, just appreciating the diversity in the room. Thank you, everyone. I think a couple more people can type in their results. So I'm going to change that. I would like you to, hang on a sec. I want to change it to the next question. Okay, here's the next one. What's your educational background? Can you see that? What's your educational background? I'm going to share again with you so you can see the slides. I want everyone to see together. Where are we? We're here, sorry, a bit clunky, but we'll get there. Okay, nursing, MBBS, right, I've got doctor in the house. Who else? BSc nursing, okay. We've got nurses. That's interesting. I've always had nurses in my classes, in the last few years. BSc in public health, okay, that's good. That's good. That's a really good foundation. Another BSc MB, well, I'm not sure what that is. BTech, biotechnology, and then genetic engineering. Oh, wow, that's a really interesting one. Fantastic, fantastic. So you've got a master's degree as well as the bachelor's. Human resource management. Again, can you all see the diversity? Those are the people in the room with you, in the class with you. So if we have a problem, for instance, we look at it from different angles. The person who has a biotech background and engineering background, the one who is public health, the nurses who are, at the front line of care delivery, the person who is in human resource management. Do you see how we can suddenly get a very rounded view of the issues? And so it means that our solutions, our recommendations are really considered because we've taken this multiple perspective view of it. That's fantastic. Okay, one more question. So we have an idea of who is in the room with you. I think some people are still typing. We'll wait for your results to come up. About 4 more. Please send in your answers. All right, let me move you to the next one. I'm going to stop for a moment and then go back to it. Do you have work experience? So that's the next one. You all should have you should be on the next question now. Do you have work experience? And again, let's do the big reveal. Is it a yes? Is it a no? Not yet. Okay, one person says not yet, and that's okay. Yes, public sector, that's good. And a couple of people in the private sector. Okay, let's see. We have a few more people in the room. Let's wait and see. Okay, a couple more people now say, not yet, don't have work experience yet. That's fine. That's fine. I'll tell you why that's not a problem at all when you come to us. Remember the theme that I've been giving you, sharing with you about multiple perspectives. This is also important. Some people are very close, right? So they have very granular, fine-grained understanding of what's going on when it comes to healthcare delivery. They can share that in the class. But there are others who don't have that. So they're sort of distant from it and they can give, with fresh eyes, give an opinion on what's happening, on what it means for the layperson. There's a saying, a fish doesn't know it's in water. So if you've been around something for a long time, sometimes you might miss some finer details, and it just takes someone with an external pair of eyes to tell you, oh, this is what this really looks like. So whether you have work experience or not, it doesn't really matter. What we urge you to do is to contribute to the conversation and participate It's active learning. You are very much involved. And it's just brilliant that we have that very diverse group in the class. Okay, now I'm going to go back to the main presentation. And we can move on from there. Okay. Here we are. I hope that's full screen. Just waiting for that to get to the full screen. Okay, there we are. So let's talk about it. What do you understand by leadership? What do you understand by management? Now keep your hand on the page, the Menti page, because I also want you to be able to tell me what you understand. So let's start with your everyday understanding of what leadership is. You've probably used that term before several times. You've also used the word manage, manager, management, especially for those who have work experience. In your own words, can you very briefly type into the Menti again? What do you understand by leadership? What do you understand? So leadership is XYZ, while management is, that's how I want you to phrase it. I think leadership is, while management is, and then we'll see your contribution. And we'll see how people think differently from India to America, to the UK, to Indonesia, to China, what leadership means to them, because these are very different cultural contexts. Okay, so now we're going to have a look and see what everyone is doing. Let's go back to the Menti page. Okay. There we go. What do you think is the difference between leadership and management? Let's see the answers that are coming through now. Leadership is XYZ, while management is. I think leadership is this, while management is this. What do you think? It's very important to come with that understanding, and then we can take it up from there and talk about what the theoretical perspectives are, what the best way it is, is to understand these two different concepts. So whether you have work experience or not, whether you've been a leader or not, whether you've led a team or not, what do you think it means? If you haven't been a leader, at least you've been a follower. Thank you. The first entry is in, all right? I'm going to show you what our first entry says. Right. Thank you for sharing. Leadership is influencing a positive change. I love that. Whereas management is working towards that positive change. Okay, that's interesting. I like the word influence in that, definition. It's very important. Again, it's come back. Leadership is around influencing people. Management, I think, is around controlling people. Okay, there are aspects of management that have to do with putting control systems in place. So you are not wrong in that sense, but you are absolutely correct that leadership is about influence. Yes, management and leadership work towards change, but in different ways. Another person says leadership is making changes, management is maintaining. That's good. That's very close to what I'm going to share with you. Another contribution, I think leadership is a character in a person. So you are talking about a personal trait, isn't it? And management is a skill. Both of them can be developed. There's a lot in there that we can unpack, and you will see why in the next couple of slides. I'll take two more contributions and then we'll carry on. Leadership is about paving a way forward through uncertainty. Absolutely. With a guiding vision. Thank you. That sounds like an experienced person. Management is about maintaining everyday standards, everyday operations, keeping things ticking along. Absolutely spot on. Another one, I feel leadership is more about being at the front and providing a role model, whereas management is interacting, contributing, and making changes to a community. Leadership is being a role model. Again, the role model is coming here. So there's something about the leader modeling the right things, the right behaviors, the right values. And that is very true. Thank you so much. Keep the contributions coming in. And I won't read the rest now, but I'm going to go back to the slide. So you will see how your contributions are actually really spot on in some areas, and the areas where we might need to fine tune your notion of the differences between leadership and management. Okay, so I'm going to stop here and then move back to the slide itself. Okay, here we go. So it's helpful if we think of leadership, as you said, as something that takes place when there is a need. So we're going to consider these two terms sequentially. So when there's a need to create a new organization, or there's a need to deal with crises, to transform an organization that's failing, right, or to bring some stability in, think of leadership as being what is needed at that point. If you're creating something new from nothing, you are really pulling in knowledge, opportunities, resources. There's a lot going on, and you're crafting this new thing that then needs to be sustained. So those of you who gave that sort of description of leadership around, doing something new, creating something new, that's absolutely correct. And so you find that it is leaders that are quite needed when you have crisis taking place. Managing, on the other hand, or management, I'm going to make this full screen so you can see it. Oh dear, we've gone back to the beginning. Management, on the other hand, has to do with, as you said, sustaining the status quo, keep the organization going, keep the systems working. And that's why those control systems, so the word control that one of you talked about, it comes to play. We need to make sure that we have enough restock of medication, enough injections, enough vaccines. What do we need to do to make sure we have them when we need them, right? Control systems, put them in place. So management is really about that. It's about deploying resources. It's about assigning tasks. It's about supervising tasks. All of these are happening within an existing hierarchy or system. Do you see the difference now? So yes, you have the managers who occupy a particular position in the organizational hierarchy and organogram, and you can think of them as they lead that team. But really, in theoretical terms, when we're talking about leadership, we often associate it with what I'm talking about, creating a new organization, stabilizing a failing one. And that requires a different set of skills, and that's where influence becomes important. You've got to be able to get people to agree with you and understand where you're going. So for example, think of a manager as someone who would give you a directive and say, go and do it, right? Directs and just pushes you in that direction. But think of the leader as someone who would come and say, why don't you let's do it together? How best can we do that? It's a more pull factor, very participatory. But again, what is underpinning that is that influence we're talking about in the context that we described. So here is a working definition of leadership, which I really like. It's by Yoko, 2010, and it's influencing others to understand what needs to be done and agree on it, and also how to do it. If people don't understand what needs to be done, and they're not with you on the same page as to how to do it, there's no way that those objectives can be met. There's no way you can meet those goals. Do you see where leadership starts? How do you get them to come and be on the same page with you? As a leader, what you're doing essentially is to facilitate individual and collective efforts, steer them in the direction of achieving the shared objectives. But this is underpinned by people understanding what so when you talk about vision, somebody shared about vision in the definition of, leadership, and, it's absolutely true. Where are you going? If you are a leader, do you know where you're going? Where are you taking people to? Do they know? If they don't, they wouldn't understand why you're doing certain things. They wouldn't understand why you're asking them to change the operating system, why you're bringing a business process improvement into the organization. They wouldn't know why, and they might resist the change. So how do you influence them? That's what leadership is. So think about yourself. What this also means is that you are not necessarily, you don't have to be at the top of the organizational chart. You don't have to be the person at the top of the hierarchy to influence. Always think about that. Okay? So now let's contextualize this whole notion of leadership and really grounded into something, real world events. And I've brought something that is familiar to everyone, the COVID-19 pandemic. We say COVID-19, but because it started really towards the end of 2019 into 2020. What's the relevance of this event? That was a global event. It was a health crisis, and it showed major gaps in the healthcare systems across the world. Prior to that time, perhaps you would not have been too worried about what the healthcare system in France was. Or people in France wouldn't worry about what was happening in Canada. People in Canada wouldn't worry about what's happening in India or in China. But all of a sudden, everyone was interested in what was going on in other healthcare systems, and we saw the gaps. All sorts of problems, failures in supply chains. We saw it on the news, didn't we? Overcrowded in hospitals. People couldn't get beds. They were just outside with their relatives. It was a really terrible situation. How about the vaccine distribution inequities? Some parts of the world had, some other parts didn't have it. So what were some of the leadership challenges that we could, sort of tease out from that pandemic? One had to do with managing rapid information flow and misinformation. So there were some groups that were really hesitant to even take the vaccines. There were lots of people leveraging technology to spread a lot of information around that wasn't exactly true. Okay, in addition to, of course, the news and all of that. The social media was being used for that. How do you deal with that as a leader? Because it would have an impact on how well you're able to combat the crisis. There was a problem of allocating resources, ICU beds, vaccines, personal protective equipment. Do you remember all of that? How do you distribute that across the different, healthcare centers in a country? How do you lead collaborations across different sectors, from the pharmaceutical sector to the healthcare sector itself, to supply chains? It required a lot of collaboration. How about maintaining staff morale and mental health? That was a huge problem. People were really terrified of going to work. A lot of people, were terrified of going to work. You couldn't stand next to someone else in the shops, morale was low because there were lots of fatalities and all. So these were some of the challenges. That singular incident that happened in one part of the world had ripple effects throughout the other part of the world and came to the desk of leaders. So this is really about leadership in times of crisis. And it highlighted the importance of transparent communication. So we were having daily briefings. I don't know in your country if you had daily briefings from, the Minister of Health or the presidency, but we had a lot of that by trusted health officials. So people knew what was going on and they were transparent with what was happening. They wanted to make sure it was timely. Again, policies were adjusting. So you saw them saying, all right, 6 people can stay in the garden. We don't want any visitor to come into your house. Don't touch people, stay away 2 feet away. Things were being adjusted as new information emerged. So it was a time of ambiguity. We were not sure what was going on. Do you see why leadership is what is really needed there? So once leadership has set that direction and the vision, then all the other things would follow. Systems thinking was also another issue there. So public health, social care, and policy response, those 3 needed to be integrated. And then equity in health management. Vaccine access, how do we make sure this is even? Where are the vulnerable populations? Okay, children, pregnant women, elderly, people who have underlying medical conditions. Decisions needed to be made about these. And that's how, the countries that were able to manage this were able to really, manage the crisis, the pandemic crisis there. Okay, so that's one situation that we can all relate to. Effective leadership during crisis requires clarity in the communication, agility, being able to respond to what's going on, coordination across different sectors, and resilience. All right, and we had the example of New Zealand and Iceland. You can read about them. There's an article I put in there for you, Grout et al. 2023, which showed that these countries performed better in terms of public trust and the outcomes in general. Okay, let's look at another context. This was the Ebola crisis. Do you remember? I don't know. We were all 10 years, but 10 years younger. And this crisis broke out in Africa. It exposed the devastating consequences of health systems that are poorly managed and, poorly resourced or under-resourced. This was really pronounced in Liberia, in Sierra Leone, and in Guinea. What was the problem in terms of the leadership challenges during this crisis? The Ebola virus outbreak really overwhelmed healthcare systems that were fragile. You see, and of course, what this tells you is that there's a need to prepare for a rainy day, because no one knew that that sort of thing was going to come at the time. And the slow initial response led to rapid spread and then global concern as other parts of the world started to get worried. I hope this is not going to spread. If someone got on a flight from one country and went to another airport and then took another connecting flight, there's a risk that the Ebola virus has spread. You're right. What are the leadership challenges? The delayed international response and a lack of local health capacity. Remember that healthcare system or in those countries were under-resourced and poorly managed. We had the issue of community mistrust of authorities and health professionals. There were also some community practices where maybe people like to touch before funerals, they still touch the person who was infected before they passed away. And that was another way that the virus was transmitted. If you are not able to curb those kind of local customs and traditions, you cannot really address the problem. It starts to spread even more. Again, training for healthcare workers was inadequate. Infection control was inadequate. Those are the things that the leader has to deal with in that kind of situation. Again, there was a lot of stigma and fear around Ebola, which impacts both patients and providers. The nurses also don't want to get infected, similar to COVID. A lot of fear, okay, particularly stigma when it came to Ebola. So what does it teach you about leadership? There's a need for cultural competency. There's a need to understand local customs, and there's a need to engage trusted community leaders. Because in some cases, in many cases, particularly in international settings, you need to understand what's going on locally to be able to have positive outcomes and achieve your objectives. What other lesson is there? There's a need to invest in building resilient healthcare systems before the crisis hits. Before the crisis hits. Because if those healthcare systems are still fragile, then it will certainly be overwhelmed. So preparedness and prevention, absolutely important. What other lesson is there in leadership? Collaborative leadership. Local actors have to collaborate with national actors and global actors. WHO, the Red Cross, they need to coordinate their efforts to make sure that that crisis is contained. The spread of the disease was contained. Also, capacity building. How do you train local staff so that they respond sustainably and swiftly to those challenges? So those are the lessons for leadership. Again, let's circle back to our definition of leadership. Influencing for change. And some of you gave that. Influencing for change. If you are able to influence, get people to understand the direction of travel, what we need to do, whether you are the pharmacist or the lab technician who is doing the test or a nurse, wherever you are, let people understand where you're going, where we all need to go, how we're going to get there. And then you facilitate those collective and individual efforts. Then you are leading. All right. So leadership lesson, just to summarize that again. The key success factors for containing the disease are the strong leadership in the emergency response, the strong engagement of the community, and of course, the international collaboration. Let's look at the third case now. This is the one that is very much, ongoing, and we all know about this one, the Ukraine conflict and the health system disruption. So there's been a war in Ukraine. It still hasn't ended. Political actors are trying to wade into the situation and see how they can just get that whole crisis to come to an end. Russia's invasion of Ukraine created a humanitarian crisis. It caused mass displacement of people and direct effects on the healthcare infrastructure of that country. I mean, we knew that there were many, even medical students who were studying in Ukraine, international students who had to flee for safety. So that conflict has severely affected the infrastructure of Ukraine's healthcare system. It has obviously disrupted medical supply chains. How do you get medication in? How do you get equipment in? How do you service and maintain? But it had also created public health emergencies for people who have had to move to other parts of Europe seeking for refuge. Many of these people needed to be accommodated and cared for in those new places where they made their homes. So the problem is not just in Ukraine, it's also extended to where these people have been displaced and where they, and where they now live. What is the implication for leadership within the Ukraine healthcare system and within the countries like the UK, Poland, who accommodated these people who have come in as, seeking refuge? Key leadership challenges. How do you deliver healthcare in a war zone in that type of situation? And it's not just Ukraine. There are other parts of the world where there's political unrest. You can think of some examples yourself. Think about the Middle East. How do you keep those systems going where there's unrest? How do you manage supply chain disruptions when there's a siege? How does food come in? How do medications come in? How do you maintain continuity of care? Perhaps some people were going through dialysis or cancer treatments or maternal health, women who have to, go for checks in the hospital for looking after them, labor, delivery, and all of that. How do you maintain that in that type of situation? That's a really complex situation. A lot of ambiguity when it comes to a war period, that type of crisis. A lot of complexity. Things change very quickly, a lot of volatility because they're driven by political factors. So as a leader, what this is telling you is that you need to engage in systems thinking. It's not just about leading within this little organization and just focusing on what I want to do within the four walls of this building or this community or this region. There are far-reaching effects. So what are the lessons here? Resilience in leadership. How do you adapt the delivery of care when you have an unstable environment? Perhaps you need to deploy mobile clinics, telehealth, use technology to reach people, to monitor what's going on. There's also the lesson about strategic planning. Remember I said to you, a leader is dealing with multiple factors. When you take in that information, what do we need to do? That's what leadership does, okay? The management of it is keeping the system going. So for example, you've brought in vaccines. How many people do we want to vaccinate? Where do they go? How do they line up? How do the managers get that done? But it's leadership that looks at the entire system, the entire ecosystem, and makes a decision about how best to overcome the challenge in that unstable condition. Ethical leadership. Under this type of sort of war situation and healthcare disruption, you have scarce resources. Who do you allocate what to? How do you decide? And a lot of doctors had that problem actually during COVID as well. How do we decide who do we prioritize, even in the ICU? That's where ethical leadership comes in. Okay, so health leaders had to adapt systems quickly to address emergency care, to respond swiftly, support those with trauma, to leverage mobile health platforms in order to continue to deliver health services. And of course, health ministries, non-governmental organizations, and international agencies had to coordinate. So this conflict, and as I said, it hasn't quite, been resolved yet, but it's just showing you there's a need for resilience in the healthcare sector. And what is key to that resilience is the people, it's the leaders, those who can make sense of the complex information that surrounds them from a legal perspective, from a political perspective, a policy perspective, a health perspective, a stakeholder perspective, and make decisions about the way forward. Okay, so those are some case studies that can help. Now, what does this mean in terms of the literature? What do we know about leadership? How has it been studied in the academic literature? So just to give you a flavor of how this has evolved through time. So there is one view of leadership which just focuses on the traits of leaders. Tall, they speak confidently, they're extroverts around people, they are very well built. It just studies the great traits. So it sees leadership as a personal characteristic. While that may be true, right? You could say if you study these personal characteristics and you can get this nice combination, then you become a leader. That's not necessarily true, because not everyone has all the characteristics. Some people are more on the introverted end of the scale. Some of you are, on the shy end of the scale. You're not the outgoing sort of bubbly type. It doesn't mean that you cannot be a leader. And sometimes what you perceive as a very good sort of trait, as ambition and boldness, it may mask a darker motive. So focusing on traits alone will not give you the answer to what is really, effective leadership. Some other scholars then decided, okay, if we cannot really understand leaders by just looking at the external traits, perhaps we can look at what they do, what leaders do. And this is what is called the behavioral approach to leadership, very different from the trait approach. And so these scholars found that through the studies that they conducted, there were certain behaviors that became prominent. It was either a concern for people or a concern for tasks. So some leaders would be more interested in the bottom line. Have you hit the bottom line? Have we met our targets? What's the reason for the variance between the target and the actual? What are you going to do to close the gap? By next quarter, we want to hear results. How much, whereas others are more concerned about people. How are you feeling today? More empathetic and all of that. I mean, those leaders who are more concerned about people, you often find a very good atmosphere within the team. People don't resign that often. Turnover is not high because they really enjoy that. The problem is that if someone is too much on that end of the scale, it may affect the deliverables. The reverse is that when you have someone who is overly concerned about tasks and less concerned about people, you can imagine what happens within that group. Maybe there'll be stress, high stress, a lot of burnout, a high staff turnover. And so the behavioral approach to leadership just focuses on what leaders do. But again, that was not enough to really tell you that leadership will be effective. So there's a third sort of wave of research or scholars which looked at a situational approach to leadership, which is that actually certain situations come up and create opportunities for leaders to emerge. And it's those situations that we should be focusing on. When the situations come up and the opportunity presents itself, then someone emerges as the leader. Think about a group project. If you're in the class and you've been given a group assignment and you all want to start to discuss how we do it, think about the dynamics of the group. How does someone emerge as the leader of that group? Eventually someone will, but again, the situation is that you've been given a task which will be assessed, you'll be graded, and you need to finish that presentation. So the situational approach to leadership is the third category, or sometimes called the contingency approach. And that looks at certain things within the situation that make it possible for leadership to be effective. So one of it could be the position power of the leader, all right? The task structure, is it clear or is it ambiguous? And then the leader-member relations, what's the relationship like between them? Is there rapport? And those different things would contribute to the situation being favorable, highly favorable for leadership to be effective. There are other views, again, that looks at multiple factors that inform successful leadership. So it's not just about the traits of the leader or what the leader does or the situation, but also think about the follower. If you as a leader deploy participatory leadership or democratic leadership, right? That's what you do, the behavioral approach. But you don't consider the maturity level of the follower. Maturity level of the follower means that the follower is able and willing to achieve the objectives. Able and willing. If the follower is not able, it means they don't have the knowledge or they don't have the skills or they don't have the training. So even if you are a participatory sort of leader or you want people to contribute, if they don't have the skills, then it hampers their ability to contribute and to achieve the task. If they have the ability, they are able, but they are unwilling, you still will not get the results. So it's one thing to think about the leader, in effective leadership, but also think about the maturity level of the follower. So this was another view from the scholars. Again, all the things I've discussed now are sort of considered mainstream ways of thinking about leadership. Then we have the critical approaches to leadership. which really try to critique these mainstream approaches. And as I was discussing the mainstream approaches, I was critiquing them slightly, if you noticed, about the trait approach or the behavioral approach, etc. So the critical approaches have a more fluid notion of leadership. Leadership as a process. Leadership can be distributed. It's not just one person. You know, all the different approaches have really focused more on one person, except the last one I talked about, which looks a bit at follower maturity. So it's not just one person. Different people could emerge at different times as leaders. That's a more fluid notion. And it emphasizes the role of the follower as well within this approach. Okay, so I hope that gives you a flavor of the emergence of the understanding around leadership through time. But again, if you think back, if you pick up any situation now around you in your part of the world, whether it's India, America, Indonesia, UK, China, think of anything, any crisis, any problem, and try and map out how that would impact the health sector at different levels. You see where leadership is needed at different levels. Leadership is needed at different levels to make sense of uncertainty, of instability and ambiguity, and give sense to those who are within the organizations that you are responsible for as a leader. Okay, so just to wrap up, if you want to understand what leadership is, there is something around who leaders are, so the personal traits, tall, well-built, the gift of the gab, people who can speak, who have charisma, who are friendly, those physical characteristics. There's something around what leaders know as well, which is also, again, part of their characteristics. There's something around what leaders do. But also think about the context within which leaders operate. There's the context of the organization that they are situated in. There's a context of the health system within which that organization operates. So there are different actors and stakeholders within that. And there is the wider global context. And you can see the different examples that I gave you, all of these layers have their place. If you are in the organization, what can you do as a leader? If you're in the wider health system context, you're around the policymakers and all, what can you do? Whatever you do has an impact on the bigger system. And then the global stage, we talked about the collaborations between the World Health Organization, International, Red Cross, etc., to combat issues at the community level. So it tells you how everything is really interconnected and intertwined. So when we talk about the healthcare system, it is indeed an ecosystem. It's indeed really combined. So another way of viewing this sort of embedded, nested relationship is to think about the leader. This is the context of leader. The internal context of the leader speaks to the leader's values and identity. Who am I as a person? What are my values? What do I believe about how people should be led? That influences how you relate with others. Emotional intelligence, do you have that as a leader? Okay, that's the internal context of the leader. It's very important to develop that. And the module that I teach in the first term really exposes you to how to lead the self. We look at things that are your blind spots, how to identify your strengths and weaknesses, how to communicate, etc. That's the internal context. Then you have the relational context, which is where you relate with other people. You get them to agree to what needs to be done and where you're going. Remember Yoku 2010, that definition we started with? How do you understand a team and the dynamics of a team? When a team is formed, it may go through a storming stage before things normalize. As a leader, how do you support the team throughout those different stages? How do you communicate and negotiate? That's the relational context for the leader. Then you have, of course, the organizational context I said before and the health system context. Okay, now I'm going to stop here for now. I can go on, but this is the final question I want to ask you. Having attended and listened to this lecture, is there anything that you will start to do differently? So there's a QR code again. From having attended the lecture today, is there anything that you will start to do differently? You could have leadership experience, you might not have it, which means you're looking to take up a leadership role. What can you think for a minute and then share with us on the Menti? And I'm going to share my screen again and show you what your colleagues have put in there. Okay, Menti is open. Let's move it to the next question. Right. Here we go. Is there anything you will start to do differently, having learned about leadership, the difference between leading and managing? I'm waiting to see your thoughts, just very briefly. Just very briefly. Reflection is also part of what we encourage you to do on the Global Healthcare Management Program. As a matter of fact, it features in some of your assessments because it allows you to take a step back and think about yourself. What drives you? What motivates you as a person? And what you intend to do. So you engage with the theoretical material, you apply it to context. We use a lot of case studies in the seminars. You work in groups to, cross-fertilize ideas and do some critical thinking, problem solving in groups. And then at the end of the day, what's the concrete change that you are going to make as a person in your practice? So I'm waiting to see. Type in the Menti just one thing. I want you to mention one thing. One thing you will start to do differently. We're waiting. I hope everyone can see it. Please type yes in the chat if you can see the screen. Lauren, could you help me check if you're getting any responses?
It's definitely
in the chat,
working.
please?
I've got it on my phone.
Okay,
so.
good. Thank you. Thank you. The first person. I wish I could give you an award for coming first. I will inquire about preliminary readings for the course and generally read more widely around it. Thank you for that. That shows you're really, connecting to the ideas. That's fine. That's fine. You want to know more about leadership. Yes, there's so much to learn, but importantly, we believe in you making a difference, in you being that change agent. So it's one thing to learn, but it's also to put that into practice. You can do it. You really can. Okay, we've got another thoughtful contribution. After this lecture, I will diversify the way I think about different situations. Yes, that's good. We want you to be open-minded as well. All right, my manager is a great leader, and I will think about qualities that she has and try to apply to my position. Thank you for that, which means you're taking advantage of the trait approach to leadership. What traits? And it's true, there's some that you can cultivate. If you think you're too shy around people, you're afraid to network and talk to others or to have a difficult conversation, there are lots of trainings you can go to help you with that. So thank you for, trying to move forward and applying those qualities to your position. Analyze myself as a leader, somebody says. I will find my strengths and weaknesses. Very true. Do you see why that quiet moment of reflection is really good? It allows you to, it's like looking in the mirror. This is me. This is who I am. These are my strengths. These are my weaknesses. How can I convert those weaknesses to strengths and just strengthen them in different situations so that I'm a better leader, right? So people can come to me and tell me the truth, right? How do I create a good climate for my team? Another person says, I will start practicing how to influence people in my environment. Thank you very much. That word influence has stood out for you, hasn't it? I'm going to influence people in my environment for good. You are a leader. Once you can influence, remember Yokel's definition? Once you can get people to agree on what needs to be done and how to do it, and just you harness all that effort to achieving the objectives, you are a leader. And one more here before we round up. I will think a bit more about carrying people on the journey. Thank you. When making a change. It's not just about bulldozing your way through the change and saying, I can do it. I've been told to do it by those higher up, so everyone fall in line. No, it's more than that. Carry people on the journey. Ensure that they know the end goal and the why. Thank you. Let them know the why behind, as they are less likely to resist the change. And that is so true. In fact, they will be champions of that change. And people will wonder, how are you doing it? Carry them along. It's worth it. It's so rewarding. It may take time to get them to trust you. Remember? Trust is also there. We didn't have time to cover it, but hopefully when you come into the Global Business School for Health, we can really unpack all of that. Once the trust is there, they will go to the ends of the world for you. And of course, they would resist the change. They will be champions of the change. Okay, let me stop here. I hope you enjoyed the lecture. I hope you found it insightful and inspiring, something that allows you to be who you're the better version of yourself. Okay, so let me stop sharing here. I can go back to my slide. Thank you all for being so active and participating, even though it's a virtual session, but you can see you have a sense of, where everyone is on the journey. Thank you so much. And I'm going to stop here. Lauren?
Yes, thank you so much. Would you be able to share your final 2 slides? And
Oh,
I'll just
yes,
talk through
please.
those.
Okay. Sorry, just a sec.
So we do have a couple of minutes for questions. So if you have any questions for Yemisi, please type them into the Q&A box now.
Okay. Can you see the slides now?
Yes.
Right, so we're here. There you go.
Lovely. So yes, we've got a mixture of people on the call today. You might be an offer holder already. You might have accepted your place, or you might still be in that decision-making part. So we've just got some key information and key dates on the screen for you. If you require a visa, our applications close on the 27th of June. And if you don't require a visa, they close on the 29th of August. If you do have your offer, you have 5 weeks to accept your offer from when it's made. And we have a real selection of scholarships available at UCL. Some of them are UCL wide, some of them are specific to UCL East, which is where the Global Business School for Health is based, and some of them are specific to the GBSH. So we would really encourage you to have a look and apply for the ones that might be relevant to you. The application deadline for those is the 29th of June, and I'm just going to post in the chat now just a link to them on our website. If we could go to the next slide, please. Thank you. And these are ways you can keep in touch with us. So I noticed earlier we have quite a few people on the call that are from London and the UK. So if you'd like to come and see us in person, next Wednesday on the 4th of June, we have our Life Medical Sciences open evening, where a lot of our program leads will be. You can come along and have a chat with us. So that's 5 till 8 p.m. on Wednesday, the 4th of June. We have other taster lectures running throughout June. So do have a look if you're still in that decision-making process. Maybe you're deciding between the different routes for global healthcare management. I encourage you to come along to a different lecture. And then we're also offering one-to-one appointments with our program and route leads. So if you'd like to chat to Yemisi or to Shayla or any of our other program or route leads for 15 minutes online, you're very welcome to do so. The QR codes are on the screen, but I am just going to share links in the chat to those 3. And then finally, we are on social media, specifically LinkedIn and Instagram. So if you want to keep up with what is happening at the GBSH, and there's always so much happening, then please follow us on our social media. I can see we've got a couple of questions and we have got a little bit of time. So I'll just go to our questions. Our first one is, are most lectures in person or online?
Okay, thank you for asking that question. At the Global Business School for Health, we have a flipped classroom approach. So we have lectures in person. We also have sessions, some few sessions online. So for this program in particular, it's in person, right? The MSc Global Healthcare Management. We have lectures, you have seminars. The lectures are large group sessions, and you see typically like what I've done. The lecturer speaks and to the class. The seminars are smaller group sessions that allows you to get to know each other more closely and to work together collaboratively, like I explained before. In some cases, you could have some online interactive sessions at the discretion of the module lead, which then allows you to, again, catch up with the learning. You have a personal tutor system, so you can meet with them either online or in person. Some of our other programs have online, heavier online components, but for the Global Healthcare Management Program, it's mostly in person. I hope that answers your question.
Our next question is, I plan on attending part-time. How will the timetable look? Can I plan my work hours around the course?
Thank you for that question. Yes, we do have part-time students studying with us. As a matter of fact, we have others who take the flexible modular route. So the full-time program for this MSc Global Healthcare Management program runs for a year, 12 months. The part-time program, it takes double that time. So for instance, in the first term, instead of taking 4 modules, you take 2 as a part-timer. In the second term, do the same thing. In the third term, you take 1 module instead of 2. And over 2 years, you complete the program. The flexible modular route allows you to take just 1 module in a term. So over the course of 4 to 5 years, you will complete the program. So some people prefer to go for that because they're working, obviously their family situation or personal circumstances doesn't allow them to come in full time. So yes, you can study if you're working, you can study part-time. As I said, the timetable will be released at some point before the first term starts, and then you can choose from, there are 2 core modules and 2 optional modules running in the first term, ditto for the second term. And in the third term, you have 2 research projects. So as a part-time student, you can choose with the advice, of course, of the program lead or the route lead, which is myself, and then look at your own particular circumstances. So if you have a day off from work and you've cleared that with your office, and it's a Thursday, then you look at the timetable, so write to the education team as well and say, okay, this is what is happening on a Thursday. Thursday is the only day I have off work, or Thursday and Friday is all I've got. And then you can choose the modules that run on those days. Okay, I hope that clears it up. So you can study part-time. It's just a matter of coordinating the days that the modules run on the timetable with your availability from your office.
Great. Got a couple more questions about timetables, actually. One of them is, could we see what a mock timetable looks like for full-time study? And the other one is, when will we get our timetables if you've accepted your offer?
Well, okay, let me start with the second question. When you've accepted your offer and you have enrolled, because you have to enroll, then you will see the platform for learning. We used Moodle as our learning platform. All the modules are there, the learning material, reading lists, all of them are on Moodle. And of course, you will be enrolled onto the program, but also onto the modules that you've selected. And that's when you get to see your timetable. Each student has a personalized timetable. And you can see that okay, I'm taking this module on this day. So on a Monday, for example, you can see from 2 p.m. to 3 p.m. I have a tutorial, whereas from 10 to 11 I have a lecture. And throughout the week, you see that. Usually on Wednesdays, we don't have lectures. It's usually Monday, Tuesday, Thursday, and Friday the lectures run. But as I've said to you, on this program, you will have 2 core modules and 2 optional modules running in the first term. And that will show on your timetable. You will have 1 lecture and 1 seminar. Does that explain it to you? So for the leadership module, which I convened, you will see the lecture, it's an hour, and you'll see a seminar for you, maybe 3 to 4 p.m. on a particular day, so that helps you to plan. So that gives you a visual sort of image of what your timetable will look like across the 4 different modules. Okay.
Great. Okay, well, we're at time now, and that is all of our questions answered. So I just want to say thank you so much, Yemisi, for your lecture today. And thank you to all of our attendees for joining us. If you do have any further questions, I'm just going to pop in the chat now our email address, which you can direct any further questions to. And with that, I just wish everyone a lovely day and a lovely weekend.
Thank you, everyone, for joining.
Thank
Look
you.
forward to seeing you.
Thanks so much. Bye.